some of the things we were doing pre-COVID are still applicable. So I keep hearing the need for person-centered, one-to-one interactions with people, really taking the time to build those relationships. We all know social isolation and loneliness doesn't happen overnight, apart from pandemic. And equally, coming out of that needs a lot of support, and it needs that really vital role of a connector, or helping to provide those social connections. And within that, there are ways of working that we've all got used to and that we developed pre-pandemic, and they're going to be needed as we move out. And again, the sorts of things I've heard is, the role of volunteers, the crucial role and the need for training and support for staff, the role of community development. That doesn't happen overnight, and that needs developing and nurturing, and also vitally the role of collaboration and co-production, and that those two go really well with this thought of community development, and that if we're really listening to our audiences and the people we're working with, we need the flexibility to adapt and co-produce and to work on the services that they need. And in turn, that needs, in order to then work together, that needs a mixed ecosystem of agencies and that can work specifically with hard to reach groups, or those client groups that have got language difficulties, or may have health or mental health impairments and conditions. So it needs a mixed model. And so the ways of working that we're used to can be applied coming out of COVID. But again, I think there needs to be that acknowledgement that we are in another position of another time of transition, and that as restrictions are beginning to be lifted, and we begin to find out exactly what the impact has been for the wider community, I think there's a bit of a risk, not within this community, but you begin to hear it in the wider community, of competition between the people who've been affected. I think we need to do an awful lot to counteract that. Everyone's been affected, but in different ways, and they need different ways of approaching that. And I think that's something we need to really work together on, which comes back to this collaboration. A number of agencies, all agencies, moved heaven and earth to redeliver services during COVID, and that led to a lot of new ways of working, which I think we ought to celebrate where it's worked well. And some of these kind of emergency hubs where people have come together, which has been kind of a one shop for people to access help, but then has been an opportunity for people to be referred to the right place, to the appropriate person that can help them best. And I think that's something to take forward as well. And this longer term collaboration and partnership working. No one organisation can fix this. We've got to work together. We've got limited resources. It's even more vital. As a funder and speaking to commissioners, I would also accept, and I think we're hearing really importantly, that coming out of this, one of the things that's really important is longer term funding. Short term funding doesn't allow you to plan very much further forward. But within that long-term funding, we're also hearing the real importance of things like micro grants and micro funding, so that you've got this full circulation system. So you've got longer-term funding, but you can then work with partners who work grassroots, who need perhaps small amounts of money to do things innovatively. Though I know that's an awful way. Not everything has to be innovation. I do appreciate that, but it does allow for that, being able to take that test and learn approach and do things, respond to what you're hearing on the ground.